Hey, future RN. Welcome to ClearPath's NCLEX. So let's talk about antiplatelet medications. They are one of the most tested drug classes on the NCLEX. You'll see them pop up all the time, especially in questions about heart attacks, strokes, and post-stent care.
My goal today is simple. We're going to walk through the main drugs, how they work, the side effects, what you need to monitor, and all that crucial patient teaching. So when you see these questions on your exam, you'll feel totally confident.
So here's our game plan. We'll start with the basics, what these drugs even are. Then we'll get into the specifics, the key players and why we use them. After that, we'll hit the really important stuff, the side effects and patient teaching you absolutely have to know. And to make sure it all sticks, we'll finish up with a quick practice drill and a final cheat sheet with all the biggest takeaways. Okay, let's dive right in. First things first, what exactly are antiplatelets? Well, the name pretty much gives it away. Their whole job is to make platelets less sticky. You can kind of think of them as traffic cops in the bloodstream, telling the platelets, hey, keep it moving, no piling up here. And this is just absolutely crucial for stopping dangerous clots from forming inside of our arteries. So, now that we know what they do, let's meet the main players in this category. We're going to look at the specific drugs you'll see on the NCLEX and the reasons why a patient would be prescribed them in the first place. These are the heavy hitters right here. You are definitely 100% going to see aspirin and Clopidogrel, which you probably know by its brand name Plavix. Ticagrelor, Prasugrel, and Silicazole are also really important to have on your radar. So how do they actually work? Well, they pretty much fall into two main groups. First, you've got aspirin, which is a COX-1 inhibitor. It permanently blocks a substance called thromboxane A2, which is like the main siren telling platelets to get sticky. Then, you have the P2Y12 inhibitors, like Clopidogrel and Ticagrelor. They block a totally different receptor on the platelet. It's like they put little earmuffs on them so they just can't hear the signal to clump together. So when do we use them? Just think about any condition where an arterial clot is the big, bad enemy. We use them to prevent a first or a second heart attack or stroke. They are absolutely essential for patients after they get a stent placed to keep that artery propped open. And of course, they are a cornerstone for managing things like acute coronary syndrome, CAD, and peripheral vascular disease. Okay, this next section is incredibly important. This is super high yield for the NCLEX. Let's talk about the key side effects and what you, as the nurse, absolutely must be watching for. The number one, most important, have-to-know side effect for every single antiplatelet medication is bleeding. Seriously, if you walk away with just one thing today, let it be this. The NCLEX loves to test on this concept. So you need to know what this bleeding looks like and how to monitor for it. You're looking for things like bleeding gums when they brush their teeth, any blood in the urine, or those classic black, tarry stools. Ask about any excessive bruising. And you'll also be monitoring their labs, specifically their hemoglobin and hematocrit, or H&H, which will drop if they're losing blood. And you'll want to keep an eye on their platelet count, because these meds can, in rare cases, cause thrombocytopenia, which is just a fancy way of saying low platelets. Oh, and remember, aspirin can be really tough on the stomach, so make sure you assess for any GI upset or pain. And here is a huge safety alert for aspirin, and it's a classic NCLEX fact. Aspirin should never be given to children or teenagers who have a viral illness. And why is that? Because of its link to a very rare but super serious condition called Ray's syndrome, which can cause dangerous swelling in the liver and the brain. Okay, let's switch gears and talk about what we need to teach our patients. These are the safety points that the NCLEX absolutely loves to ask about, because they want to know you can get a patient ready for a safe discharge.
First, you've got to teach them to report any signs of bleeding immediately. Second, and this is a big one, they must avoid other meds that increase bleeding risk, especially over-the-counter NSAIDs like ibuprofen. That combination is really risky for GI bleeds. Third, to protect their stomach, always take aspirin with food. Fourth, it's the little things that make a big difference, right? So teach them to use a soft, bristled toothbrush to prevent their gums from bleeding. And finally, and this is so important, they must never, ever stop taking these medications abruptly. Especially after getting a hard stent, stopping suddenly can actually cause the platelets to go into overdrive, leading to a massive rebound clot right where you don't want one.
All right, you have absorbed a ton of information. So let's do a quick drill with some NCLEX-style questions to see what's really sticking. I'm going to read the question, I'll pause for a few seconds to let you think, and then we'll go over the answer. You ready? Okay, first question. Which drug class does Clopidogrel belong to? I'll give you a few seconds. If you said P2Y12 inhibitor, you are correct.
Remember, Clopidogrel works by blocking that ADP receptor so platelets just can't get the signal to clump up.
Question number 2. What is the most important side effect to monitor for in a patient taking any antiplatelet medication? Take a second to think.
The answer is always bleeding. You should be assessing for those key signs like black tarry stools, blood in the urine, or bruising easily. And our last question for this drill. A patient taking aspirin daily should be taught to avoid which over-the-counter medication class?
The correct answer is NSAIDs, like ibuprofen. Taking aspirin and an NSAID together is basically a double whammy on the stomach lining, and it just dramatically increases the risk for a serious GI bleed.
You did an awesome job on that drill. Let's wrap everything up with a final summary. This next slide is your antiplatelet cheat sheet. It's perfect for a quick review or to just screenshot for later.
Let's lock this in one last time. Remember, aspirin is your COX-1 inhibitor. Clopidogrel and ticagrelor are your P2Y12 inhibitors. The number one side effect is always bleeding. Your key monitoring is for signs of that bleeding and checking H&H and platelet levels, and your most essential teaching points are to report bleeding and avoid NSAIDs. You know, antiplatelets are actually pretty predictable on the NCLEX. If you can master these concepts, you are going to crush these questions.
And that is a wrap on antiplatelets. Thank you so much for studying with me at ClearPath NCLEX. If this review helped you, please hit that like button and subscribe for more high-yield content. And don't forget to hit that little notification bell so you never miss the next game-changing NCLEX tip. I've got a question for you. Drop a comment below and let me know which antiplatelet you find the trickiest. I promise I read